I'm 81 years old. I feel great, but I've noticed lately that I have trouble remembering people's names. I never had that trouble before. I still am very visible and vocal and give lectures and talk, and I want to make sure my brain stays good. I want to stay bright-eyed and bushy-tailed. I should not forget somebody's name when I know that person. And that I'm smart enough to know that's the first sign of the fact, that's an early sign that your mind is starting to deteriorate. And most of it, this will happen to most people, but if there's a way to stop that, in my case, I'm going to do it right away, because I want to continue to teach and educate. I can't do it if my mind isn't good. And I feel that Dr. Josephs is one of the most capable men in this whole area, in this whole state, of even beginning to cope with these problems. He knows what to do and how to do it. He's up to date. He's got an excellent mind. He really cares about patients. And therefore, I felt good about coming here. It's your child's world, but it's also your world. And so I'm talking about schools in there, but your house is exactly the same. You're sick because many people are sick, not genetically, that can make you more prone to illness, or because they have an infection or there's a terrible stress in their life, but you're sick because of something you ate, touched, or smelled. And you have to figure out what those things are. And in Chapter 3, it tells you exactly how to figure out why you're sick on Tuesday afternoon, why you're sick when you go in a certain house, why you're sick when you're outside, not inside, why you're sick after you eat, and how to figure out which food is causing it. In other words, I write books that are just common sense. How do you figure out why you're sick? Can you get rid of it? And if you can't get rid of it, what's an inexpensive, effective substitute? Get rid of the microwave and get a toaster oven.
The microwave just kills the nutrients.
Oh, the microwave is terrible, terrible, terrible. It kills the nutrients, it ruins the food. In mice or rats, it causes cancer, and it causes cataracts. And you can say, well, I'm seeing now. I see fine, but hey, you get to be my age at 81, you want to keep seeing fine.
What's that?
I'm just getting chelation.
Oh.
Okay, I'm getting chelated. I don't want to have a stroke, and I don't want my brain not to function as well as it's been functioning. So in order to keep myself bright-eyed and bushy-tailed, I have to have my blood vessels cleaned out. So I'm here to get clean blood vessels. There,
Can you close this?
Yeah.
And I'll get one shot with you in the book.
Okay, that's good. Okay, this is now shot. Okay.
Can you hold it up?
Yep.
You're going to tell us about this book?
This book is entitled 32 Tips That Could Save Your Life. And in a nutshell, I'm telling you how to prevent cancer, thyroid disease, diabetes. I'm giving you tips on what to do and what not to do, the common things in your house. And I go into the kitchen, the living room, the bedroom, the bathroom, basement. I tell you what, in general, in your whole house can be causing trouble, and what can cause trouble in specific rooms or specific homes. You feel great, you move into an apartment, they just pesticided it, and you're sick. Well, you've got to realize that you might get progressively sicker if you stay there. You move into a moldy house. Mold is terrible. It's not just hay fever and asthma. If you have a problem from a mold, it can affect your brain. And depending on which area of your brain, your symptoms will depend on which area of the brain are affected. In certain areas over here, it could be your reading, your writing. In the frontal lobe, it's more apt to be your disposition, your personality, whether you get anxious or upset. And so different areas of the brain can be specifically affected, which will make you feel very sick. This city is loaded with doctors that are doing things in unconventional ways, and some of them are having fantastic success. And nobody knows about it because they can't advertise. They can't let anybody know. It's got to be by word of mouth. We have a stupid system. You can know how to go ahead and help some illness have fantastic success, and no one is going to know about it because you have to stay under the radar. If you let this known and you're doing something different than everybody else, you can have your medical license taken away from you, even if you're successful. The bottom line is not the patient. The bottom line is, are you doing it according to the rules?